like I said, addiction is really a manifestation of underlying something, environmental factors, psychosocial environmental factors are very important in addiction. Meaning, if you do have anxiety or depression, I can't really treat your addiction unless I treat the underlying anxiety or depression. So what I do usually, I give my patients, antidepressants if they're depressed. I give them anxiety pills. I avoid, of course, any control substance such as Xanax, Ativan, Klonopin, things like that, because they already have addiction and these are addictive medications, so I avoid those, and there's no need for them. In fact, there is no studies show, I hate to use the term study because sometimes small studies don't make much sense too, but there's no evidence that these medications work. What works really is antidepressant. Sometimes we add antipsychotics or mood stabilizers. Mood stabilizers really work very well with addiction to stimulants such as cocaine, for example. You can use mood stabilizers and they actually work pretty good, pretty well. The other thing is some antipsychotics, they do work as a mood stability agents, mood stabilizers, for the treatment of anxiety and maybe adjunctive to the treatment of depression. Of course, I leave that up to the psychiatrist. But since I am a psychiatrist and addiction specialist at the same time, I actually treat the underlying mental issues. I hate to also say mental illness because most of the times it's not really mental illness. It's just a underlying issue. Could be stress, could be a mental phenomena, not necessarily illness. You see what I'm saying? Because nowadays everybody, we use the term mental illness very casually. It's basically overrated.